It's time now for Scoop, our weekly conversation on international media and the political and economic headwinds confronting the industry. We look at who shapes a narrative, explore journalistic ethics, and ask the reporters the difficult questions. With trust in the press at a nadir, it's a critical eye on a critical profession. Well, the Hantavirus outbreak may be small, but it could be a big test for journalists. And it's important to remember that this comes after a Gallup poll last October showed record low trust in U.S. media of just 28%. For Republicans, confidence in mass media is only at 8%. And since the COVID-19 pandemic, surely we, the media, have learned our lessons, right? Right? Well, here's a Daily Show looking at U.S. media coverage.
Breaking tonight, the deadly outbreak of a rare rodent virus on board a cruise ship.
The public health threat so dangerous.
Nightmare at sea.
A cruise from hell.
It's like they're all trying to recapture that pandemic ratings magic. Remember the old big screen body counts? All the ways they scared us? Well, the counts are back. Obviously, not as compelling.
There's one person who tested positive. A separate person showed symptoms, but we don't have a positive test result for that person.
One positive and one runny nose? What? Damn, this thing is spreading like, I don't know, what's something that doesn't spread? Cold butter?
And those are skewing mainstream media for social media won't find it any easier. Influencers and others have seized the Hantavirus outbreak to revive disinformation that sowed distrust during COVID. Here's public health expert Laurel Bristol speaking to Vox.
Who appeals to emotion, who tries to get you to panic, is probably not a trustworthy source, because anyone who works in infectious disease outbreak, anyone who works in research, knows that there is no point to panicking. It's not going to change the situation. So I think this appeal to emotion that's happening with a lot of people is a good way to get engagement, especially because people are so heightened after having experienced COVID.
So if it isn't the media or social media, where should people get reliable information? The federal government? But the Trump administration has made deep staffing cuts to the Centers for Disease Control and other agencies. And that means fewer people, fewer trainees, contractors, virologists, epidemiologists, fewer boots on the ground. In short, fewer people to respond to outbreaks. And Donald Trump also withdrew the United States from the World Health Organization. So the U.S. does not receive regular information about health threats. The New York Times wrote, quote, to some public health experts, the alarming thing about this situation is not the hantavirus. It is the administration's sluggish response and lack of communication suggests the United States is ill-prepared for a larger health crisis, such as another pandemic. When asked, the U.S. president brushed aside the question. Take a look.
Thank you, Mr. President. What do you say to infectious diseases experts who say they're worried the country may not be prepared to deal with something like hantavirus because of all the HHS, funding and staffing cuts?
Well, I think we take care of that. Do you want to answer that?
It's just not true.
Well, the U.S. and the world's preparation for any deadly disease has long been a concern. This is a clip from the 2019 Netflix docuseries Pandemic: How to Prevent an Outbreak. Take a look.
It's not a matter of if, but when.
It just takes one person to start an outbreak. The next pandemic is going to start, and we just don't know where or how, but we know it will.
That poses an existential threat to us as a species.
Well, our guest is Dr. Sheri Fink. She was co-executive producer of that project, MD, PhD, and is a correspondent for the New York Times. Sheri, thank you for speaking to Scoop. That project was released in 2020, 8 days before the WHO declared a COVID-19 outbreak pandemic. Now you're working on a COVID book, just as another disease is making headlines. I'm guessing some conspiracy theorists might be scratching their heads about your sense of timing. But I just want to begin by asking you about what have your observations been about media coverage of this hantavirus?
Well, the media has a very difficult role. Media has to provide information, address the fears, provide, stop people from panicking if panic is not warranted, which it typically is not warranted. On the other hand, saying don't panic is a good way to make people scared. So also having to provide information. And I do think the media that are dedicated to truth, to correcting mistakes, that is a good place to get information because, and same with public health authorities, most of them anyways, their goal is to provide accurate information. I think the big role for the media is to tell the public and for the public to know that some things might be wrong at the start. Some things that sound really definitive might get more nuanced. And so we can expect that. And the thing is to, keep up with things and keep looking at the latest information with good sources like that, sources that are going to do their best to provide the best information.
Yeah, this is an evolving process. While I have you here, I want to ask you some questions that I see a lot of people asking on social media about this. Going back to when the ship was evacuated, a lot of people were saying, why not just keep everyone on board until the incubation period passes and then this whole problem would be done and dusted? It's not as simple as that, is it, though?
No, if people get the hantavirus, they could get very sick. And being on a ship is not a great place to get very sick. And we already saw the death that occur on the ship. So getting people to containment facilities, to the proximity of hospitals that can provide intensive care because there's no actual, antiviral, this is a virus treatment, but supportive care, intensive care can make a difference to life and death. So it did make sense within a very controlled environment. And we saw a beautifully executed from all reports, evacuation, a safe evacuation of this ship. And people are now, for example, in the US, they're in a quarantine facility, very near a hospital that can take care of them with very, very low risk to the general public.
Yeah, and I want to ask you about that evacuation because some people were wondering about what the messages were coming from Spain's health minister or the WHO. We see the teams in protective gear receiving the passengers. We're showing the images now as I ask you to. And if there's a limited risk, then why is so much protective gear needed? Some people felt like that sent a mixed message.
Right. So there is a limited risk to you and to me because we are not in proximity to the people who had a high risk of exposure in this case. Yes, the images look scary, but that's the role of the media, right? Is to provide that context to say, actually, what they're doing, they're wearing masks, they have protective gowns on, and that's to protect the people who will be coming to escort them onto the private plane. So actually, the media's role could be to provide the context there and say, yeah, this looks scary. This reminds us, we're all traumatized still. A lot of people don't want to talk about it because of what we just went through, this very deadly actual pandemic of the coronavirus. So that is a real role for the media. And also, I think to get us curious, well, we are interested, and that can be a positive thing because it helps. Perhaps there are young people watching and they get interested in a career in public health, or we suddenly think, maybe we're going to prioritize that some of our tax money should go to studying these viruses that are maybe neglected because they happen in places far away from wealthy countries that have lots of resources to do that research. So this kind of coverage and this curiosity of the public, as long as things are contextualized, can actually be a positive thing in some ways.
Yeah, I just want to ask you, you touched on it earlier. Where is the line for informing the public, for the public good, stoking fear or panic, or as CNN said, CNN ran a piece, I don't know if you saw it, but they said calm mongering and how it risks triggering post-COVID anxiety if people are too calm when they talk about this. So how do you approach it as a journalist?
That's very true. And when I'm a medical doctor by training, became a reporter. I remember going out and reporting on Ebola in West Africa in 2014. And I had such a sense of mission. I'm going to go there and show the public what this really is so they understand better. And information is the antidote to fear. But sometimes it can stoke fears. And so I think, that was a little naive of me. But I do think that yes, it's important to provide this information, to answer questions, to, again, like I'm going to say it over and over again, the information will change. You did hear public health officials early on being very definitive. Nobody can get this unless they're like really close contact. And well, there are some examples of where, different types of contact might allow the virus to transmit in maybe rarer conditions. And this is an opportunity. This outbreak will be studied. We will have better information. And so, keeping track of that and following this with reputable sources that are dedicated to trying to provide the best information, I think that's what's really important. And the media, it's not that we shouldn't cover it, but we should cover it with good context. And, it's tough because people do want definitive information, but that's not always available. So we have to provide, when you and the public watch the media, think about what is that risk to me? And then the larger context.
Yeah, and real quickly,
those are two different things.
Yeah, real quickly, scientific literacy, always a challenge for someone in your field, making the lay public understand the risks, what's at stake, but also not trying to, as we've been discussing, make them panic. Under the current administration, though, we played this clip earlier about how the Trump administration has been gutting a number of agencies, including the CDC. So how much harder is it for a reporter to do their job when some people are saying they can't even get a call back from the CDC because of all these layoffs that we've seen?
Yeah, well, I think this is a good reminder of why we invest in our public health infrastructure. And, actually the U.S. has done has withdrawn from the World Health Organization, but does still get updates through something called the IHR, the International Health Regulations. So it's a reminder of, and perhaps there will be some changes in some, but if the public says, well, we do care about this, then that might shift things. And yes, it is hard to get information. It has been hard under previous administrations too. So again, there needs to be good transparency, good communication from public health officials. I think that's very important to update the media. There's a bit more of that now that we've seen some press conferences from the CDC, limited, short, but consistent in the last few days, and those are available for the public also to click on the CDC website. But they do need to make public health experts available to people in the media, so people in the media can provide accurate information to the public to translate that science into what does it mean for me? Am I at risk? Is my family at risk? Do we need to change our behavior? Or is this just something very interesting to learn from?
Sheri, thank you so much for your time. We'll keep an eye out for your book. Dr. Sheri Fink joining us from the New York Times. And that brings us to our quote of the week, and it is a cartoon from Patrick Chapat with a couple alarmed by news about the Hantavirus outbreak, and one says to the other, "Quick, put the war on the Middle East back on." That's it for this edition of Scoop. Thank you for watching, and please stay tuned to France 24.